It's really, really popular in Korea and China and lots of the Asian countries where there's a myopia pandemic. Like myopia has become a real issue and there's really high myopes. And I've mentioned why for high myopes, ICL is a really good option. I think people like it because it's reversible. It's done in a theatre setting, so they're asleep during the surgery or sedated during the surgery. I think it's just a good adjunct alongside laser. So I don't think one replaces the other in my books. I think you just have to work out which one is more appropriate for your individual patient. Sometimes patients can have both and it then becomes up to them to kind of look at the risk profile. So it could be argued that because ICL is intraocular surgery going inside the eye, the risk profile could be slightly higher than, say, a laser procedure where it's on the surface of the eye. So I think you just have to weigh up the risks. So I go through those in detail at our consult, but I don't think one replaces the other. And there's some patients that will be a good candidate for LASIK and a good candidate for ICL. And then really it comes down to what the patient's comfortable with after we go through the different risks. So because ICL is intraocular surgery, the risks of really severe complications, which are exceptionally rare, may be slightly higher than, say, a surface procedure like LASIK. But overall, I would say for both procedures, the overall risk of major complications is exceptionally low. And we go through this in detail at our consultation, and we also have a consent form for both procedures that's very thorough, and it goes through all the different aspects of the kind of the risk-benefit profile.
So when you're going through that consultation with patients, are there any common misunderstandings that patients have about these procedures when you're talking to them? Are there any sort of common questions?
Not really. I think lots of people don't know about ICL. So I have heaps of patients that come into my practice saying like they want LASIK or they want Smile Pro or they want Presbyond. And I think that ICL, especially in Australia, it's not as well known yet. It's getting there, but it's definitely doesn't have the same, I would say it definitely doesn't have the kind of same following as in China or Korea or somewhere where there's really high volumes of the procedure. And it's good because they come in and I tell them about something new and then they're like, oh, and then they go and read about it and then they have multiple options. So I think that's the main thing. Otherwise, I think we explain everything else pretty clearly in our consult. So I don't think that that's a major concern. I usually explain the difference between cataract surgery and clear lens extraction or RLE to patients. And then again, the difference between Presbyond, because some people don't realize that Presbyond is a laser procedure on the surface of the eye, whereas the other surgeries that we're spoken about mainly today are done in the hospital out of the clinic in an operating room. So I think we explain it all, but I think it's very important to make the different differentiations between the different surgeries and the different categories and what they're actually achieving. But they're all really good surgeries. I think that's the point. Like, there's not one that stands out. I think that they're all good as long as you choose them for the right patient. And that's our job. Like, we make sure that we're saying, Paul, you're actually good for RLE and ICL is not good for you and whatever.